Good morning, everyone. It is a pleasure to be here today. Every day, hundreds of women around the world lose their lives due to pregnancy-related complications, most of which are completely preventable. This reality became even more serious in rural areas, like those in Sudan, where access to basic maternal health service remain limited. My name is Dr. MADLEEN MOHAMMED, a fifth year medical student at Imperial University College. Today, I'm presenting as a part of the Rural Residency Program, MED472, representing Group 2. In this presentation, I will be discussing maternal health service in rural Sudan, highlighting the key challenge, underlying factors, and potential solution. And now, to truly understand this issue, we need to ask a critical question. Is the problem only related to the availability of maternal health service, or does it go beyond that to include women knowledge, attitude, and practices? Okay, this research was designed to address these questions and to explore the underlying factor affecting maternal health outcome in rural Sudan. To begin with, maternal health is one of the most important indicators of the quality of any healthcare system, as it doesn't only affect women but also has a profound impact on family and entire community. Maternal health service encompass three essential stages that are critical for safeguarding the life of mother and newborn. First, First, antenatal care play a vital role in monitoring the health of both mother and fetus, allowing early detecting of potential complications such as gestational hypertension, anemia, or gestational diabetes. Second, intrapartum care refer to skilled attendance during childbirth by a qualified health professional. This step is crucial in reducing maternal mortality as it ensures timely intervention in cases of obstructed labor, postpartum hemorrhage, or eclampsia. And finally, postnatal care during the first week after delivery support maternal recovery and helps prevent complications such as infection, severe bleeding, or postpartum depression. Together, these three stages form the backbone of maternal health service, ensuring continuity of care and significantly improving survival outcome for mother and infant. The central challenge in Sudan, particularly in rural areas, is the persistently high maternal mortality rate, despite the fact that most underlying causes are preventable. Common preventable causes include postpartum hemorrhage, preeclampsia, and eclampsia, obstructed labor, and maternal infection. These conditions, if managed promptly, should not result in death. However, several interrelated factors exacerbate the situation. Number one, shortage of skilled health personnel. Number two, weak health infrastructure. Number three, geographical barrier as a long distance between village and health center delay emergency care. Number four, armed conflict and political instability. Okay, to better understand maternal health challenge in rural Sudan, this study is based on an important public health model known as the KAB model. KAB stands for knowledge, attitude, and practice. First, knowledge refer to the woman's awareness and understanding of maternal health service, including antenatal care, safe delivery, and postnatal care. Women with better knowledge are more likely to seek medical care at the right time. Second, attitude reflect women's belief and perception toward healthcare service. In some rural community, culture, belief, and previous experience may influence whether women trust healthcare facility or prefer home delivery. Third, practice refer to the actual behavior such as attending antenatal clinic, delivering in health facility, and following medical advice after childbirth. These three components are strongly connected and together they determine how women utilize maternal health service. Okay, one of the key framework used in this research to explain maternal health challenge is the three delays model. This model identifies three critical delays that contribute to maternal mortality. The first delay is the delay in decision to seek care, which is often influenced by lack of awareness, cultural belief, or limited decision making power. The second delay is the delay in reaching healthcare facility, mainly due to long distance, poor transportation, and geographical barrier in rural area. The third delay is the delay in receiving adequate care once the woman reaches the facility due to shortage of staff, equipment, or essential supplies. This delay clearly shows that the problem is not only medical but also structural and social. These results were derived from the analysis of the data collection throughout this study. The result shows that women in rural area had relatively good knowledge and positive attitude about maternal health service. However, the main problem was not awareness, but the lack of available and accessible health service. The study also found gaps in health education and awareness. In addition, several factors affect maternal health in this area, such as low education level, low income, and traditional beliefs and practices. In conclusion, maternal health in rural Sudan is not only a matter of healthcare service, but a complex issue shaped by knowledge, attitude, practice, and the overall strength of the health system. This research has shown that improving service alone is not enough. Real change requires increased awareness, addressing culture, belief, and strengthening the entire healthcare system. As a future doctor, we have a responsibility not only to treat patients but also to educate, communicate, and contribute to improving health outcome. Because at the end of the day, every mother deserves a safe pregnancy and a safe delivery. Finally, I would like to sincerely thank you for your time and attention. It has been an honor presenting this work. Thank you.